Heart attack symptoms. A heart attack happens when there is a loss of blood supply to a part of the heart muscle. It often results from a blockage in a nearby artery. A person who is experiencing a heart attack or myocardial infarction will feel pain in their chest and other parts of their body, as well as other symptoms. Spotting the early signs of a heart attack and getting prompt treatment is crucial and can save a person's life. Let's learn about it. What are the symptoms of a heart attack? Chest pain or discomfort that suddenly occurs and doesn't go away. It may feel like a pressure, squeezing, or heaviness in your chest. It can feel like indigestion or a burning sensation that may spread to your left or right arm, or may spread to your neck, jaw, back, stomach feeling sick, sweaty, lightheaded, or shortness of breath. What causes a heart attack? Smoking, a high-fat diet, diabetes, high cholesterol, high blood pressure or hypertension, being overweight or obese. How do you stop a heart attack immediately? Have someone call an ambulance, take aspirin, and wait for emergency services. Women or men, who has a higher risk of heart attack? Some studies suggest that during a heart attack, women are most likely to have atypical symptoms such as nausea, dizziness, and fatigue. But other research finds that regardless of gender, the symptoms usually are more similar than different, says Dr. O'Donoghue. I think that women may overlook even the classic heart attack symptoms like chest pain and pressure, she says. They also tend to minimize their symptoms and delay seeking treatment. In fact, one study that measured how long people waited before seeking treatment for a heart attack found a median delay time of about 54 hours for women, compared with about 16 hours for men. Anecdotal evidence suggests that men often say their wives urge them to go to the emergency room when chest pain strikes. Can a child have a heart attack? Kids and teens can get heart diseases and have heart attacks. Some parents worry that their child might die suddenly. Fortunately, this is extremely rare for children. Most children with heart problems are successfully treated, and many live an active and healthy life. It is understandable to feel very protective of your child if they have a heart problem, yet many children can be independent, play competitive sports, and do almost all the things that other children do with very few restrictions. Check with your doctor about what level of physical activity is safe for your child. If your child's childcare center, kindergarten, or school is concerned about your child taking part in regular activities, or you are given conflicting advice by another health professional, talk to your child's cardiologist and ask for a letter about what your child can and cannot do. Can one meal cause a heart attack? Share on Pinterest. A single meal high in fat, such as those typical of fast food, may immediately wreak havoc on your arteries, shows a new study. It is well known that a diet high in saturated fat is a contributing factor to the risk of heart disease. How to prevent heart attacks naturally. Eat a healthy diet, be physically active, watch your weight, avoid processed junk foods, increase omega-3 fatty acids, avoid or reduce alcohol intake, and manage stress levels. 8 foods that are good for your heart. Leafy green vegetables, like spinach, kale, and collard greens, are well known for their wealth of vitamins, minerals, and antioxidants. Whole grains, berries, avocados, fatty fish and fish oil, walnuts, beans, and dark chocolate. What foods are bad for your heart? Baked goods, French fries, ice cream, cheese, pizza, soda, and diet soda, deli meals, candy, high fructose corn syrup, fried chicken, wheat bread, biscuits, fruit juice, Chinese takeout, potato chips, jarred tomato sauce, coffee creamer, margarine, sugar, red meat, blended coffees, bacon and sausage, frozen meals, and more. Are bananas bad for your heart? Bananas contain fiber, potassium, folate, and antioxidants such as vitamin C. All of these support heart health. A 2017 review found that people who follow a high-fiber diet have a lower risk of cardiovascular disease than those on a low-fiber diet. What happens with exercise? The only bad workout is the one that didn't happen. Just as exercise strengthens other muscles in your body, it helps your heart muscle become more efficient and better able to pump blood throughout your body. This means that the heart pushes out more blood with each beat, allowing it to beat slower and keep your blood pressure under control. When you exercise regularly, your body's tissue, including the heart, does a better job of pulling oxygen from your blood. This allows your heart to work better under stress and keep you from getting winded during high-intensity activities. Physical activity also allows better blood flow in the small blood vessels around your heart. Clogs in these arteries can lead to heart attacks. There is also evidence that exercise helps your body make more branches and connections between these blood vessels, so there are other routes for your blood to travel if the usual path is blocked by narrow arteries or fatty deposits. Exercise also increases your level of HDL cholesterol, the good cholesterol, that lowers heart disease risk by flushing the artery-clogging LDL or bad cholesterol out of your system. Along with lowering your risk for heart disease, exercise keeps your weight down, improves your mood, lowers your risk for some types of cancer, improves your balance, reduces your risk of osteoporosis by increasing your bone mass, gives you more energy, and helps you sleep better. How much exercise do you need to prevent heart disease? Regular exercise is an important way to lower your risk of heart disease. Exercising for 30 minutes or more on most days can help you lose weight, improve your cholesterol, and even lower your blood pressure as many as 5 to 7 points. A sedentary lifestyle where your job and your leisure activities involve little or no physical activity doubles your risk of dying from heart disease. This is similar to the increased risk you'd have if you smoked, had a high cholesterol, or high blood pressure. The best exercises for heart failure: brisk walking, running, swimming, cycling, playing tennis, and jumping rope. Heart-pumping aerobic exercise is the kind that doctors have in mind when they recommend at least 150 minutes per week of moderate activity. Can drinking water prevent heart attack? Almost every time you have a doctor visit, your doctor reminds you to drink the recommended 64 ounces of water each day. Drinking water keeps you hydrated, helps you maintain or lose weight, and keeps your body healthy from diseases. Did you also know that drinking water could also prevent a heart attack? According to the cardiac specialist, drinking water at a certain time of the day can prevent a heart attack at night. Most heart attacks happen between 6 a.m. and noon. Therefore, if you experience a heart attack during the nighttime, something could be wrong. Drinking 1 8-ounce glass of water before going to bed can help avoid heart attack. If you avoid drinking water before bed because of the urge to use the bathroom in the middle of the night, there is a solution. According to a cardiac specialist, when you're lying down, the lower body seeks level with the kidneys, and it is easier for the kidneys to remove the water rather than standing upright. If this confuses you, the simple answer is drinking more water to prevent a heart attack. Drinking water before bed helps level out your blood throughout your body to prevent heart attacks throughout the night and the early hours of the morning. Along with drinking water to prevent heart attacks, drinking water provides you with countless benefits for your body to live a strong, healthy life. Are there more heart attacks in winter? In cold weather, the blood vessels constrict, forcing your heart to work harder. This pressure on the heart in some cases can lead to a heart attack. One way your body responds to cold temperatures in order to protect itself and retain heat is by constricting the blood vessels near the surface of the skin. When this happens, blood flow is reduced to these vessels, which means more pressure in the rest of the system. This in turn means that the heart has to work harder than usual to get oxygenated blood around the body. This raises blood pressure and increases the chances of blood clots forming, both of which are factors in heart attacks and strokes. Why do heart attack rates rise on Monday mornings and the week after daylight savings time begins? Stress is a known risk factor for the development of cardiovascular disease, says Dr. Sharma. Dr. Sharma says jolt of going back to work, facing reality once again, each Monday following a restful weekend can bring added stress. Both physical and emotional stress can cause a release of hormones like adrenaline and cortisol that can trigger heart attacks. There's the added risk brought on by a consumption of alcohol. Weekends bring the opportunity to imbibe, and some people overdo it. According to the American Heart Association, heavy drinking can raise the fat levels in your bloodstream. It can lead to high blood pressure and heart failure. Heavy drinking on weekends may be related to higher rates of heart attacks that occur in Mondays. The good news is that the yearly death rate from heart disease is on the decline. Still, on average, someone is having a heart attack in the United States every 40 seconds. Can daylight saving time hurt the heart? Switching over to daylight saving time and losing 1 hour of sleep raised the risk of having a heart attack the following Monday by 25% compared to other Mondays during the year, according to a new U.S. study released on Saturday. By contrast, heart attack risk fell 21% later in the year on Tuesday after the clock was returned to standard time and people got an extra hour's sleep. The not-so-subtle impact of moving the clock forward and backward was seen in a comparison of hospital admissions from a database of non-federal Michigan hospitals. It examined admissions before the start of daylight savings time and the Monday immediately after for 4 consecutive years. In general, heart attacks historically occur most often on Monday mornings, maybe due to the stress of starting a new work week and inherent changes in our sleep-wake cycle, says Dr. Amneet Sandhu, a cardiology fellow at the University of Colorado in Denver who led the study. Can you have a heart attack after stents? What is stenting and how does it prevent heart attacks? The risk of re-narrowing the artery is about 10 to 20% when bare metal stents are used. Blood clots. Blood clots can form within stents even after the procedure. These clots can close the artery, causing a heart attack. The need for a stent arises when arteries carrying blood towards your heart get blocked due to cholesterol depositions. The stents are metal mesh coils inserted in the narrow arteries to smoothen the blood flow. These are usually deployed after a heart attack to smoothen the blood flow in the body. The stent also helps in keeping your artery open and prevents any blockages. What is the best treatment for heart attack? You might receive clot-dissolving drugs or thrombolysis, balloon angioplasty or PCI, surgery, or a combination of treatments. About 36% of hospitals in the U.S. are equipped to use a procedure called percutaneous coronary intervention or PCI, a mechanical means of treating heart attack. What are the best foods to eat after a heart attack? The Heart Foundation recommends that people with existing heart disease, including those recovering from a heart attack, should follow the heart-healthy eating principles with some key changes. Choose reduced fat and unflavored milk, yogurt, and cheese. Consume less than 7 eggs per week. Include 2 to 3 grams of plant sterols per day from fortified food products like special varieties of margarine, milk, yogurt, and breakfast cereals to assist in lowering LDL cholesterol levels. And if you consume red meat like beef, pork, veal, and lamb, eat no more than 350 grams per week. Eating healthy food can help you recover and reduce your risk of more heart problems. A balanced, heart-healthy diet can decrease the risk of cardiovascular disease, or CVD, events and mortality, and CVD risk factors such as high blood pressure and high cholesterol.